At University of Virginia Health System, we're for sharing the latest health information from top minds to keep you and your family healthy. With UVA Health System Radio, here's Melanie Cole.
Should you consider lung cancer screening and what's involved? My guest today is Dr. Charles Malpass. He's board-certified physician in pulmonary medicine and critical care medicine, whose specialties include lung screenings. Welcome to the show, Dr. Malpass. Have there been any recent changes to the screening criteria, and what exactly is lung cancer screening?
Absolutely. And so a large part of this is based upon a publication from 2011 in the New England Journal of Medicine. It actually showed that we could save lives by doing a low-dose lung cancer screening CT scan of the chest. And so there's three societies that have weighed in on what's the target population for lung cancer screening. But the big piece to know is that age of 55 to 75, someone who has smoked for greater than 30 pack years. And so to do the calculation, if you smoke one pack of cigarettes for 1 year, that's one pack year, so 30 pack years in total. Or if you were at, say, 2 packs a day, that's only 15 years of smoking, and the person is a current smoker or has stopped smoking in the past 15 years, has really been our target population for lung cancer screening.
What's involved in the screening? Is this a complicated thing?
No, very simple. And so it's a low-dose CT scan of the chest. This is a radiation exposure comparable to a mammogram, or basically a few chest X-rays. There's no IVs, there's no medicines given to you for that, and only takes a few minutes in the CT scanner to obtain the study.
So then if people have been 30-pack smokers, 30-year pack smokers, or 15, or even a half a pack a day, are they somebody who should get screened? Who do they talk to, first of all? And is this something that insurance will recognize?
Absolutely. Great questions. And so really what was done with the study and what we're doing now to try to really kind of mirror the findings and the work process of the study is trying to capture that highest risk population, which would include people that had recently quit smoking within the past 15 years and have had a large exposure with that 30-pack year history. We do not know the answer to the question of if you smoked for 15-pack years history, is this a beneficial screening study for you? That question is just not known, or that answer is just not known and has not been studied yet. And so we looked at to see to kind of choose the highest risk population to say could we exert a benefit for these patients with that. And so we just don't know that second question yet.
Okay, so if somebody does get screened, and what are you looking for in that screening?
And so what we've done here at UVA is really kind of pattern or have the radiologists pattern their practice of reviewing the CT scan and identifying kind of small nodules. What we want to do is be able to find lung cancer early so that we can change upon it mostly through surgical methods of curative intent. The problem with lung cancer is the lung does not sense pain itself, and so it's insensate. And so by the time someone develops symptoms associated with their lung cancer, often it's too late. We can't make huge differences in their care as far as complete removal of that lung cancer, and we can, if we find it early, we really can embark on improving their mortality and also markedly improve them there. So what we want to do is be able to find small nodules and very kind of the earliest stage of lung cancer in the lung itself.
Dr. Malpass, you use the word screening. We use the word screening. So it's not a diagnostic test. Is this something that goes on a permanent record? Because people hesitate to go in to have something that they think is going to follow them.
Mm-hmm. And so it is a study that the results of will be in your medical record, though, and I completely agree that it is not a definitive test in that you can identify a nodule of the lung, but it really takes following that nodule over time and or a diagnostic procedure of sampling that nodule to be able to say what it is from. If we look at our population as a whole here in Central Virginia and across the Eastern Seaboard, there's a very large number of people who have never smoked and that are going to have lung nodules on their CT scan, which should not affect their health care or their access to their health care, and can be a very benign finding. And so with the screening CT scan, we often do find something, and that's why we want to target the highest risk population of those former smokers to be able to increase the probability of that being a possible cancer in our diagnostic procedures.
Well, what about the non-smokers? Can they get screened as well?
And so at this time, I do not think it's beneficial for those people to get a screening CT scan. The lung cancer does occur in the non-smoker, though to a much smaller extent in comparison to the smoker. And so it's a balance of exposing those people to radiation that they don't need to be exposed to. If we do find something, exposing those people to potentially the risk of a diagnostic procedure, whether it be a biopsy or further radiation screening. And we do not think that is immediately beneficial for those people in that screening process.
And does insurance cover this particular screening?
Mm-hmm. Good question. And so if done correctly and mirror kind of the trial that it was done where you have a discussion of the benefits of screening, the risks of screening, the radiation exposure, and also targeting the right population, if that's done correctly in concert with a smoking cessation intervention, it should be covered most often by insurance providers in this process with the appropriate documentation.
Are there any recent advances and exciting things that you want to quickly discuss in the field of lung cancer treatment, things that you want the listeners to know about what's going on out there in the field of research?
Absolutely. And so what we're trying to do on the pulmonary side, which also often is on the front end in diagnostics and identifying patients that do have lung cancer and appropriately getting them into oncologic care and surgical care as appropriate, is that we have methods of minimally invasive methods of sampling the lung and identifying what that process is. So here at University of Virginia, we offer bronchoscopic procedures that would facilitate sampling of lymph nodes central into the chest, which is a same-day procedure and can be done under minimal sedation, the same sedation that would be done for a colonoscopy. We offer procedures where we can target lesions from kind of the inside bronchoscopically through navigating through a CT scan. Also on the radiology side, they offer comprehensive services as far as diagnosing from kind of the outside in and biopsying via a CT scan as well too, abnormal lesions. And additionally, importantly, in targeting that person's, if it is a malignancy, targeting that person's malignancy through genetic testing. We offer a TrueSight genetic screening panel, which is done on all non-small cell lung cancers that are of adenocarcinoma, and can really allow us to do some targeted new therapies, which are exciting in practice.
That's absolutely fascinating. And in just the last minute, Dr. Malpass, why should someone come to UVA Pulmonary and Respiratory for their treatment?
Absolutely. I think we do an excellent job of coordinating our services, and so on a weekly basis, we meet as a group and allow kind of close face-to-face communication of providers that are all helping take care of patients. So if, unfortunately, someone does develop lung cancer, face-to-face, I'm talking to the surgeons that potentially could provide curative care. I'm talking to the oncologist. I'm talking to radiologists that are specialized in just thoracic imaging. Additionally, I'm talking to radiation oncologists. And so under one roof, you have specialists in all fields of medicine to complement that care to try to give them early aggressive care in treating their process.
Thank you so much. You're listening to UVA Health Systems Radio. For more information, you can go to uvahealth.com. That's uvahealth.com. This is Melanie Cole. Thanks so much for listening.